Hey guys, in this video we are gonna talk all things manual therapy, what it is, what is therapeutic massage, how does it work, is it worth it, everything. So first thing we are gonna talk about what is manual therapy in the context of musculoskeletal rehab. So manual therapy would be a mix of techniques that are mainly made up of three different groups. These are joint mobilizations. So this would be when you go to rehab and your physio moves your hips, moves your knees, moves your shoulder in a relaxed state. There are of course different caveats and different techniques, but the most common ones are in a relaxed state. There is also joint manipulations, which are what we commonly know as cracking. It's pretty much the same thing as joint mobilizations, but at a higher speed. And we will talk a little bit later about the effects of each. And then last one is soft tissue massage, which is the main focus of this video. But as we will see later, the effects of all these three kinds of techniques are very similar. So these groups of techniques will be used in rehab in different contexts, but the main idea is that they will be used to relieve pain or to increase range of motion. So I want to talk about these different techniques first for having a clear understanding of what we are talking about. There is what we would call an old and a modern paradigm. What do I mean by this? There is the old ideas about what manual therapy is supposed to do and the modern ideas. We are going to talk about both of them so that we are all in the same page and understand what all this is about. The old paradigm consists of a more straightforward explanation where the tissue that we are working on manually is the source of pain and is the target of the treatment. What do I mean by this? That if our knee hurts, the theory is that by touching the knee tissues, we would be healing them or promoting healing. It's an understandable set of ideas from a historical perspective, especially taking into consideration that manual therapy has been done for hundreds and thousands of years. But what I want to give as an idea is that it's not up to date with current scientific evidence. We will see that our action, our effects on the body are not the healing of tissue per se. And then there's the modern paradigm. What does the modern paradigm consist of? Well, it's based on current scientific evidence and it's based on understanding manual therapy as a temporary pain relief tool and also as a temporary range of motion increasing tool. As you can see, I linked to different papers in which researchers try to explain the different mechanisms by which manual therapy work. We will talk more in detail about it, but the idea is that through the mechanical motion of the tissues, we induce a whole body hormonal response that decreases pain, not necessarily that it fixes any tissue damage. So let's see some common misconceptions about this old paradigm about manual therapy. And also, when I say old, sadly, it doesn't mean that people don't say these things nowadays, because you will see lots of professionals that will spread these ideas. And this is one of the reasons I want to make this video, just for you to have clear information of what is actually going on during your treatment. So the idea that palpation findings are the source of pain, like imagine your neck hurts a lot and I happen to touch your neck under the base of your skull and suddenly it hurts there a lot. And I tell you, oh yeah, just by placing my hands in here, I'm gonna release all the tension and I'm gonna fix all your problems. Well, reality is not as impressive as that. a lot of the times the answer is way more complex. If we have stated in scientific literature that palpation findings are not a reliable tool to find patient pain, mostly because it's not really comparable between professionals, meaning where one professional may touch you, it may hurt more. Where one professional may touch you, it may hurt less. In general, it's not a very reliable tool. Also, as we said, the idea of healing damaged tissues. Our hands don't have the amazing power of healing by touch. I think that's very naive to think that by touching a tissue, we are promoting vascularity, we are promoting long-term changes to that tissue. There are certain techniques like lymphatic drainage that may have more solid evidence, but in terms of healing soft tissues, the evidence just isn't there to back up these ideas. Also, the idea of relaxing tight muscles. This is very similar if you are familiar with meditation. This is something very common, which is said, which is like relaxation is not the objective of meditating, but it may be a side effect. Well, I feel like it's a similar situation with massage and with manual therapy. Relaxation is not the main objective, it's the decreasing of pain, but the decreasing of pain may induce a muscular tone relaxation. However, there is no direct relationship between the tightness of muscles and the pain associated with it. Some people may have higher base muscle tone, some people may have lesser muscle tone as a base, but it's extremely widely varying between individuals. Also, the repositioning of structures. If we said healing damaged tissues is a bit naive, imagine repositioning structures. There is no way with pressure on our hands we can move permanently and long-term structures so that they stay fixed in a place or that we realign certain structures. Changes are only temporary. And also undoing tight knots. This is a bit of a controversial one, but the idea of tight knots is very under debate lately. There is not such thing in literature as tight knots. There is the concept of trigger points, but it's clearly a concept which should not be nearly as used as it is. So when you come to a clinic and you say, hey, my neck hurts, it's full of knots, well, that's a bit too much of a statement. We will talk in a future video about trigger points, but I will just say for now that it's extremely under debate. Any other long-term claim affecting the tissue, meaning we are going to do long-term changes to the body by doing manual therapy, the evidence again just isn't quite there. So we have talked about things massage does not do, so let's see a little bit more what massage does do. So it provides temporary pain relief and increase in range of motion. It's very important, the idea that these changes are temporary. That's why a lot of the times you go to the chiropractor and they crack your whole body up and you feel great. It's a temporary effect, but then week after week you have to keep going to keep your muscles being cracked to feel better. It's not a reliable treatment of itself. It needs to be packaged with some other long-term tools. So how does it work? In the body, it creates a response through different mechanisms. These mechanisms are hormonal by creating a pain relief response, mechanical by moving the tissues and forcing new ranges of motion, nociceptively, again, by decreasing pain through the different mechanisms we will see, and psychological because of the different expectations of treatment. So this is a flowchart about the mechanisms by which manual therapy works through a mechanical stimulus on the tissue or in the joint. we create a response on that joint that decreases muscle spasm and increases range of motion. We also create a cascade of neuromuscular responses and hypolgesia, which means the decreasing of pain, by inducing different effects like a pressure stimulus that will saturate pain nociceptive pathways, meaning by applying pressure on a joint or by doing movement, the neurons in that joint will be saturated by new information. It's like when we rub our skin after hurting ourselves, it's just saturating the pain pathway so that we don't feel as much pain. And there are also different non-specific responses like expectations of treatment, placebo. If we believe that manual therapy will do a lot of good for us, then the effect will be increased. Different kind of hormonal responses. And also an autonomic response of increasing on the skin temperature and the heart rate, which will be pain relieving by definition. So as you can see, by the mechanisms by which these techniques work, except the mechanical stimulus, the response is not localized. What do I mean by this? The response is not only happening in the targeted tissue. Imagine you are having manual therapy done to your shoulder, except the moving of the shoulder and the shoulder tissues. The rest of the effects will be systemic, meaning it's not quite as important the technique used or the targeted tissue. Of course, if we are hitting the targeted tissue, expectations of treatment will be fulfilled, but it's mostly a systemic response. Why is this important? This is important because it's been shown in research that it doesn't really matter which technique is used. It doesn't really matter the skill of the therapist. What does matter is applying manual therapy in a context in which it will be useful for the patient. Let's see a little bit more about this. So if we accept that the response is systemic, then we can get to the conclusion that there are no expert hands. And what do I mean by this? What I mean is that the result in pain relief may be exactly the same if applied by a professional with 40 years of experience in manual therapy, or if it's been done by students which have been trained in the basics of manual therapy. The response will be the same because pain relief response is systemic, it's not targeted at the tissue. The skill doesn't quite matter since we are not healing the tissues with our touch, we are just promoting a full body response. By this reasoning, there's another misconception, which is that stronger will be better, and by this I mean beating up the patient. And I want to say that it's not the case, stronger is not better. We want to create a relaxing experience in which the patient feels better than he was feeling before. This means there is no need to beat our patient up. There is no need to make them feel destroyed after the session. We just want to create pain relief and we want to use manual therapy as a tool to make them feel less pain. There is absolutely no point, no scientific evidence to back up that doing manual therapy in a stronger way is better for pain relief. In fact, it may actually be worse because we are just increasing patients' pain long term and not letting the healing process happen. Imagine if I told you that by hitting you as a boxer that afterwards you would heal and feel amazing. Well, you would say, well, of course, if you've beat me up, my body's just gonna try to heal from that and then try to fix itself from all the damage you've done. Well, in a way, it's the same if I try to beat you up with massage or with mobilizations. Like, what's the point of beating you up and having you feel pain and having your body try to heal from all that pressure on our body. It just makes no sense. Okay, so let's talk a little bit more about some final ideas about manual therapy in rehabilitation processes. I want to say that it's not a first option treatment for a lot of musculoskeletal conditions. What I mean by this is that scientific evidence doesn't really tell us it's a must. So while other treatment tools like exercise are almost all of the times a must for rehabilitation, manual therapy isn't. So manual therapy is just one of many tools we have available in physiotherapy for treating pain. Not having manual therapy used in a rehabilitation process doesn't mean the process isn't correct. Again, it's just one of many tools. We have many other tools which work just as well for treating pain. It also does not work and shouldn't be used as a standalone treatment. Since the effects are short-term and temporary, what we want to use are long-term treatment tools that will help empowering the patient to understand their pathology and to have tools at their disposal that they can use at home to help themselves, like exercise or education. Again, most of the treatment time in rehabilitation process should be spent with more active therapies such as exercise, such as education. Does this mean manual therapy is useless? Absolutely not. It's a great tool to relieve pain. It's a tool that is easily accessible in rehab clinics, but it should be used wisely and far away from old misconceptions. So let's see an example of treatment. Imagine a patient comes to a clinic because he has neck pain of long duration. It's what we would call mechanical pain. There is not really an underlying cause behind it. It may be a combination of bad postures, lots of exercise, bad sleep, etc. And we have a different team of physiotherapists working on his condition. So let's imagine we have three of these therapists, and each of them is going to do a different treatment. Therapist 1 is going to do a treatment based on manual therapy and exercise. So he may do a little bit of soft tissue massage on the neck, a little bit of joint mobilizations, and he will also teach the patient some exercise to do at home. Then we have physiotherapist 2, which is going to use dry needling, TENS, and exercise, which will all be aimed again at relieving the neck pain the patient is feeling. And then we have physiotherapist 3, which is going to use education and exercise. Education is going to be consisting of teaching the patient which things he can do to relieve their pain, maybe teach some of the correct ideas about pain, like what is actually happened, like if herniations affect their pain, also teaching different ways of fixing pain at home, etc. The point here is that all these three treatments will be just as effective. As you can see, therapies 2 and 3 don't use manual therapy, and it doesn't matter. The improvement as seen in the scientific literature is usually the same no matter which pain relieving tool we use, as long as long-term alternatives like exercise are included in the treatment. So don't worry if you are in a rehab process and manual therapy is not part of the process. Your therapist isn't lazy, your therapist doesn't hate you, it just isn't a must in treatment. So thank you so much for watching this video. I will leave you linked here a couple of videos I uploaded a while ago. I hope that they are of interest and that you like them. See you in next video.